you, everybody. We'll get started on our next panel right now. For this next panel, we'll explore air quality and health. And when we are done with the conversation up here, we will also open the floor to questions as well. So please welcome the moderator for this session, Dr. Grace Lewis, and she'll introduce the panelists.
Great.
Thank you, Dr. Lewis.
Thank you, Andrew. And thank you for coming to our air quality and health panel. So this afternoon, we are going to have some illustrious panelists here who will explore the intersection between air quality and public health impacts. So we're bringing together research experts with clinical work about how pollution, climate, and community environments shape health outcomes in our region and beyond. So I want to briefly introduce you to our panelists. We have Dr. Sudhir Al-Kindi, who is a physician scientist focusing on environmental influences on health, and he is the medical director of the Center for Health and Nature and an associate professor at Houston Methodist Hospital. He's a member of the World Heart Federation Workforce on Pollution and has authored more than 400 peer-reviewed publications. His research emphasizes how pollution, climate, and neighborhood factors shape cardiovascular risk. We also have Dr. Yun Hong, an assistant professor of environmental and occupational health at UT Health School of Public Health. She directs the Health Atmosphere Nexus Group, where she studies how air pollution, extreme weather affect human health using satellite remote sensing, artificial intelligence, and community insights. And Dr. Juan Aguilera, associate professor at UT Health School of Public Health also, and his research focuses on environmental and climate health, particularly how factors such as air pollution, nutrition, and physical activity affect health in vulnerable populations. He is a GeoCafe scholar, a recipient of the American Society for Nutrition pilot grant, and previously worked at Stanford University's Allergy and Asthma Research Center. So please welcome our panelists. And today I'm going to kick us off with a question to Dr. Al-Kindi, which is, what air pollutants pose the greatest public health risk in our region?
All right, thank you. Can you hear me?
Slide it towards the front of the mic. All right, can you hear me? Great. Thank you for the introduction, and I'm glad to be here. I think when we talk about air pollutants, there is thousands, maybe millions of air pollutants. And to contextualize this, people have characterized air pollutants into the most important, the most at least studied, most linked with health outcomes. And under the Clean Air Act, we have what we call criteria pollutants. Criteria pollutants are pollutants where the EPA has defined specific thresholds for, at least we want to achieve them. We believe that there is no safe limit for any air pollutant, but at least there is specific thresholds that we believe that are achievable and are associated with reduced or lead to reduced adverse events and health outcomes. When it comes to our region, there's between the 6 criteria air pollutants, the two most important are ozone at number 1 and particulate matter at number 2. These are the most important in the United States, but more importantly in our region, in Houston-Galveston area. And unfortunately, Houston, because of variety of reasons, we have one of the most pollutants metropolitan areas in the United States. The latest state of the air report reported that the Houston area is the 7th most polluted with respect to ozone. The average days of unhealthy ozone days in Galveston and Houston are approximately 30 to 40 days a year. So 10% of our days are spent in ozone levels that are higher than what we hope to achieve. Of course, this is based on some models and so on and so forth, and Dr. Hang and others have been working on refining this limit and understanding this a little bit better from our region. But I think it just speaks to the fact that although we have very good healthcare and probably one of the best in the world, we also suffer from one of the most polluted environments that can impact our health. And that's something that we have to address and think about a little bit more.
Great, thank you. And what about hazardous air pollutants? Is that also a concern?
Yeah, so that's a very good question. And I would say that there's a lot of uncertainty. Of course, it is a big health concern. The problem is because of the difficulties with measuring these hazardous air pollutants, and how to estimate them and how to link them with health outcomes. We know from animal studies, we know from controlled human studies and relatively small studies that there is an impact on human health. That being said, I think there is a lack of understanding on how big of a problem it is, given the changes that happen temporally and spatially with respect to these exposures. I want to say that in the past week, actually, there was a paper that looked at the global burden of these hazardous air pollutants and their impact on health, and it showed that there is an underestimated, significant problem globally with respect to there's a specific type of air pollutants called BTEX, which is a combination of compounds. And unfortunately, at least the data that we have in the Houston-Galveston area, that we have a lot of these pollutants in our air. And that's something that will be refined over time and to understand, first of all, what are the sources, and we believe that we know, the complexities of the sources of that, but also what is their impact specifically in the Houston-Galveston populations.
Thank you. And for those of you who may not be aware, BTEX or BTEX is benzene, toluene, ethylbenzene, and xylene. So they're a group of similarly structured aromatics. Yeah. So next, I'd like to ask Juan or Dr. Aguilera Mendoza, how is climate modifying the health risks associated with air pollution?
I got it. Thank you so much for the question. And I would like to follow up with something that Dr. Akini was mentioning, because when we talk about the exposures, it's not that we're in an isolated model. I mean, all of these exposure, whether it's pollutants, bioaerosols, are all part of the environment in which we are interacting with. So just to try to measure a single pollutant or to look at a single metric, it's not ideally what we are exposed to. And this is why it has been so difficult to actually say, well, there's an increased risk for health because of this type of pollutant or for this type of pollutant. All of them are interacting with each other, and then we have to factor in the climate. And we are changing climate in which we might be seeing increased temperatures. Now the interaction of heat with all these pollutants are gonna be increasing some of the exposure. For example, when we talk about the criteria pollutants, ozone, nitric dioxide tend to interact with each other, and heat is part of that equation in which the pollutant coming from traffic, which is nitric dioxide, often interact with sunlight. Eventually that gets transformed into ozone. And if there's more temperature exposure to that, then the interchange between these gases is gonna be affected as well. In regards to allergens, we were going to see that with the increased temperatures, then the allergy season is now prolonged. What it used to be about 5 to 6 months, now we're seeing extended up to 9 months. So with that, there's more of a predominance of the allergy season. And again, with the presence of the allergens, then the respiratory uptake changes within the body, and you're also increasing your exposure to some of the other gas pollutants as well. Then, of course, Houston, it's an urban area with a lot of buildings in the downtown areas where many people work, live, interact. And because of that heat exposure, we also see an effect of what they call the urban heat island, which is basically the increased temperature as it interacts with the buildings. It creates a much larger temperature difference and within these areas. So regardless of what's being reported in your weather monitors, the temperature does feel different when you're surrounded by buildings and less vegetation. So that also increases the amount of exposure, time of exposure, and also how some of these pollutants are interacting. So just being aware that there's not gonna be a simple solution or a simple metric, but that we are in a dynamic environment. I think a lot of the lessons can be drawn from what we experienced during COVID times, because what was in the air became of relevance, and how we interacted with it, whether it was at the personal level and at the community level, it was something that was always present in our minds. So it is something where now, as we see in the changes with climate, even though the timing is different, the presence is there, so we need to be mindful.
That's a very thoughtful answer, and I appreciate that. And also that increased temperatures also affect the health of the person who is responding to all of the pollutants and everything as well. So thank you. And if any of our other panelists want to add on to these, please feel free to jump in. But I will move on to Dr. Hong's question, which is, can you tell me, is air quality the same across our region, or are there actually areas that present a greater health risk? Specifically, I know that there are newer satellites that are helping us to understand these spatial differences in air pollution. So maybe you can speak to us a little bit about that.
Sure. Thanks.
Oh, is that on? I think you might have to. Yeah.
Okay.
Thank you.
Thank you for the great question. I appreciate the other two panelists' answer to the two questions you have answered. I would say definitely it's different. For example, in the broad Texas, like we have two examples here. Sadia is from Houston and Huang is from El Paso. And he mentioned in Houston, we have elevated ozone pollution, and PM 2.5 might be the second one. But in El Paso, maybe we have more exposure to dust pollution because the weather there. So it's different. And also, both of them mentioned the air pollution is very complicated, have so many components. For example, they both mentioned a term called PM 2.5. I'm not sure if all of you are familiar with it. It's defined as, it's a fine particle, defined as the diameter of the particle is smaller than the 2.5 micrometer. So in the past 20 years, so many researchers, they have been studying the PM 2.5, the relationship with different disease. However, this definition is just quantify the size of the particle. We don't know the chemical components of it. However, from the lab experiments, we have been knowing that different chemical components, they have different toxicities to our human health. So the frontier of air pollution and health research, we want to distinguish different chemical components inside of this, the fine particle. And back to the cases in Houston or Brownsville, think about when you walk on a street or close to traffic corridors, you may have more exposure to particularly nitrate. It may that much toxic, but if you close to a wildfire smoke, maybe it has more components related to like elemental carbon or organic carbon. They may have elevated toxicity, so it's different. And it's an ongoing research direction. And back to your questions about satellites, it's very, very exciting, I would say, like this decade. Because about 2 years ago, we just launched a new satellite called TEMPO. You can search the word TEMPO, TEMPO. That provide hourly observations of the ozone pollution, which is the top one air pollution risk factor for our Houston area. Like every hour, even like better resolution than that, we can see the map of the total column ozone pollution. That is one satellite launched 2 years ago. And next year, in 2026, in the month of June, we'll have another new exciting satellite called MAIA, M-A-I-A, MAIA. This is the very first public health satellite invested by NASA to study the chemical components of the PM 2.5. So that's the two satellites that I'd like to share the information. And if you're interested in this kind of data, I mean, the launched one for the temple is open to the public. It's entirely free. You can just go to the website, take a look at the ozone pollution level, like for today or yesterday. But remember that this is observations from space. So it has a lot of errors. And it's my job to translate this satellite data to more accurate ground level ozone pollutions. Yeah, so that's the general background. I'm talking a lot about satellite data because my role with NASA, like in the past more than 10 years, is to application of the satellite data to public health and air pollution research.
Yeah, and as a follow-up to that, I think it's really important because, like, from my presentation, I was saying that 2/3 of the counties across the United States don't have any air monitors.
Yeah.
And so I think it's really important to understand the role that satellites can play because these are virtual blind spots. And so satellite data, which we've used in our U.S. Climate Vulnerability Index, allows us to have coverage at a very finer scale resolution for the entire United States. So it gives us that air quality and other temperature and other data that is really important. And as a quick follow-up to your answer, like, we're not atmospheric or satellite scientists. Is the website or is there somewhere that you can actually, the average person can understand this satellite data?
Yes, of course. Thanks for the very important question. We have a NASA team called HACAST. It's short for Health Air Quality Appliance Science Team, HACAST. And if you search this word, you can find a fabulous website, put all the information there to help people who does not have any background in satellite data, remote sensing, or atmospheric science. And it's all free. So we have spent a lot of time to develop the network, the website, and tools for you to use. Yeah, and if you have any questions, just search my name, find my email address, or we just talked after the panel, and we can discuss
Thank
more.
you. I think that makes it so much more accessible. So I've got another question. Dr. Aguilera Mendoza, based on your work, can you tell me about some populations that are more vulnerable to air pollution and explain why that is that they're more vulnerable?
Thank you for that question. I think it's very important as we start to do this work and when we're talking about this interaction with the environment to consider different populations. And as we do air quality work and research, we have noticed that people in the spectrum of life are particularly impacted by the differences in air quality. So children, the elderly, the relationships with the children usually comes because of their respiratory systems being at early development or during the development, but also they have increased respiratory rates. So there's this connection between like the physics of how they breathe in and why they breathe in more particles. Whereas the elderly, they may have other afflictions and they may have other conditions that also limits their lung capacity in regards to the air quality. But also, you mentioned something very important in regards to the size of the particles, because we're talking about 2.5 micrometers. To give you a perspective, our red blood cells are about 7 micrometers. So these are particles that are even smaller than that. And as we breathe in some of these particles, they're able to go from our respiratory system, diffuse and go into our bloodstream and affect our cardiovascular system as well. So there's been research in the past decades about the relationships with cardiovascular disease, whether it's stroke, whether it's heart attacks. It's been really staggering to learn that a lot of the mortality indexes are also influences related to the air quality. Organization for the World Health Organization, I think, released a figure about 8 million people have been affected because of air quality, and this number keeps increasing. Hence, why is this call to provide better air quality, educate the people, but also legislate and find policies that are going to protect vulnerable populations. And then when we start to talk about the stages of pregnancy, we started to learn that also air quality affects both pregnant women and they're developing children in that sense. And the changes might be something that is not noticeable at birth, although there's some studies with regards to their birth weight and things like that. But then epigenetic studies starting to look at what are the long-term consequences for your growth in regards to having been exposed to air pollution when you were still in your mother's womb. So I think it's very important to consider first of all, like spectrums of life, specific populations, but then also the occupational exposure. It's something that comes to mind. And this is often an area that is not as explored as much. And we see occupations like steel workers, firefighters, they are often exposed to all these different particles, and we're starting to see higher rates of other diseases. Just to throw in a factoid, I mean, the average lifespan for a firefighter is 10 years below the average, and it's attributed mostly to their exposure to the occupation. I mean, the fumes that they're exposed to, the chemicals in some of the fumes, it's going to be one of those factors that there's still more research that needs to be done. But as we already have identified the increased risk, we need to start to think ourselves, well, what can we do about it? How can we better protect these groups? And how can we want to come together both as individuals, members of the community, policymakers, politicians? It takes a village to create these types of changes and to protect those that is also part of our responsibility, because we know how can they be affected.
Thank you. And I think that makes me actually really brings it home to Dr. Johnson's keynote address, where she was talking about exposures during different stages of life and development, and so how important that is for us to understand, like in utero, for instance, or during pregnancy, what happens if a mother is exposed to high levels of air pollution, and what are the ramifications of that on the baby and her health as well. And I wonder if, and just to kind of like build on this question, you could think about, because I know you guys are in public health, the impact on outdoor workers. And I think we were all seeing that during COVID, that people, maybe they're coming from communities of color or low wealth, and is that a compounding factor as a vulnerable population?
I would say it does add up, because all of these factors are part of the equation, and being mostly outdoors is going to expose you to all these pollutants. And I mean, there's going to be a lot of lessons, and don't want to necessarily go back to the COVID example, but then again, it makes us think like, well, who was mostly vulnerable during that time? And likely it's because they had a higher exposure to what was in the air. And if we can draw conclusions based on that example, we can definitely think about, well, what about air pollution? We know the timing changes because it's more of a short, medium to long-term exposure. And with that in mind, it's okay. If we notice this in regards to the movements of a small virus in the environment, well, what does it mean in regards to all the chemicals, all the pollutants, and the particular exposures of occupations, minority communities, people that deserve better health, and also the spectrums of life and pregnancy?
Yes, absolutely. I think that is a really good example. So back to Dr. Hong, and then we're going to have one for Dr. Alkindi. So what are some broader public health strategies or actions that we should consider to prioritize improving health risks posed by air pollution? And actually, you can start it, but any one of you guys can lean into that question. I think you all bring something different to the table.
Sure, thanks for the question. I would say two directions. First, I would say have a air pollution alert is very important, like real-time alert or like predictions. For example, for the next day, next 3 days, I see we have some alerts, but the resolution is not that accurate, and air pollution levels can change dramatically just from one block to another block because there are so different pollution resources. And we have been working on to integrate different data sources, like from the satellite data, from the ground data, even from the local sensors owned by our community stakeholders. We have AI techniques to integrate all that data together. However, in the past years, people have been developing these tools use just like AI algorithms. But a word we have been increasingly talk about is trustworthy AI. How to build up alert that makes sense, not just play with the data, not just have a publication. I've heard a lot of ways publication is a trash. It will not help build up public health in reality. Well, I would say maybe in the next 5 years, we can have more work to do some trustworthy AI work to do the air pollution alert. That's one example. Another example I would say is from my experience for the past 3 years from project funded by NASA. So I was fortunate to lead a project about air pollution health. This project was co-designed by the stakeholders, like the community stakeholders. So you can see from my answers to your previous questions, I'm a tech guy. I'm kind of nerd. I'm like play data. However, these technologies can help support community stakeholders. For example, I am blind. I just moved to Houston recent years. I was at Emory University in Atlanta, so I'm not entirely sure what's the local needs in terms of air pollution and health, although I have the technology. So I would say it's very important to have like multi-sector, multiple interdisciplinary research collaborations to work together. For example, you know me today, if you want me to help you solve some problems or research questions or some other things, just tell me how I can help with that. Otherwise, I feel I'm useless. Like a few months ago, I was at a town hall meeting close to the NASA center in the area, and a lot of people give a presentation, not a lot, other people, guest speakers, they give talks about Houston situations, how they solve the problems, and some covers air pollution, but they use a lot of like air monitors data. As Grace, you mentioned earlier, air monitors are very, very expensive. We just have like a sparse distributed monitoring network in Houston and Texas. And for the chemical components, we even don't have that much monitors. So I felt I was ashamed there. I just talk about satellite technologies, and I didn't help the community directly. So I really appreciate if you have the time, you can talk to me, and we can have some collaborations together to solve the issue, or at least mitigate the issue here. I won't call it issue. It's like make the air quality better. Yeah. Thank you.
Yeah, and I'm very interested in the idea of what some of your work in AI is. Does that mean like you're thinking about incorporating large amounts of like activity patterns for people, or what type of AI information is going to be integrated, or is it just AI that's like crunching all the numbers from the satellites?
That's a great question. I have seen some researchers, they develop an AI-driven tool. They want to make the numbers look better. For example, the performance of the model, the R-square, RMSEs kind of things. However, I think the model maybe consider more factors such as how long you stayed outside, where you stayed, if it's close to your traffic corridors or you're at a park. It's very important about the location and how long you stay outside. And this type of information may not that much useful previous years because the satellite data resolution is low. But as I mentioned earlier, we have new satellites that can measure hourly the ground pollution, not ground pollution, the pollution from the space. Well, see the pollution from space. So we have like new technologies, and this type of factors can be considered in future AI models or like AI-driven alerts.
Cool. I look forward to it. So Dr. Alkin, oh yeah, please go ahead.
So I think it's great to kind of improve our estimation of someone's exposure to air pollution, noise pollution, whatever that is. I would say that, that all assumes that the effect is homogeneous across populations. And going back to Juan's answer previously, that we know now from science that there is heterogeneous impact on different populations. We know that minoritized communities have higher impact, even if they were exposed to the same level of air pollution, let's say particulate matter or ozone, they get a higher per degree increase. They get a higher increase in their cardiovascular event rates and asthma and so on and so forth. So the question is really, how can we leverage persons' health data? And this is something that on the health side of things, right, on the hospital side, every patient that comes to us has a zip code in front of us, right, and we know where they reside, but we just never interpret that zip code into an actionable framework from an environmental perspective. So linking the personal health profile with an improved satellite, driven estimation exposure assessments becomes really, really powerful. And I think I can tell you that from an air quality alert system, we have one in the United States. We've done a lot of analyses on how this works, and it really doesn't work as well as someone thinks it does, because the number needed to prevent one heart attack or one respiratory event is humongous. We need to alert and millions of people, and every single one of them has to act upon the recommendations of AQI to actually prevent one event or two events. So my thinking is really we need to target the air quality alerts to specific individuals who may benefit the most, right? So who can actually, have an impact on their population health. And this is the trade-off between what we call population health, and everybody has to control their blood pressure and everything, versus personalized precision population health, where we focus on the highest risk individuals, and it's not like we're ignoring everybody else, but we at least focus all our resources on, or most of our resources on, high-risk individuals, so that the average gets better over time.
Absolutely. And I think that tees us up very well to the question I was about to pose to you, which is, how can healthcare providers better integrate air quality awareness and climate risk into patient care? And I know that's a great question for you, because we've been working on a research study together.
Yeah, I think this is basically what we were talking about just earlier. We have residential address on every single patient that comes to us, right? We scan their ID, we know where they live, we have zip codes, everything is structured in a format that we can understand it. We just never interpret that into an exposure assessment. And you probably have seen papers and newspapers that talk about how the how the zip code is actually more important for your health than your genetic predisposition. And in our estimations, about 60 to 70% of the health outcomes, primarily obesity and cardiovascular disease, can be explained by zip code characteristics. So now, how do we make that connection, and what do we do with this information? One is, first of all, how do we translate this zip code or the census tract or the address into a framework of environmental exposures? And Dr. Lewis and I, we've been lucky to get a grant from Weill Cornell to study this and integrate this. So she and her team has developed something called the Climate Vulnerability Index, which has 184 variables at each neighborhood in the United States. And we've been studying the impact of utilizing this risk score, or environmental neighborhood risk score, with respect to health outcomes. How can we refine it? How can we create it as a health framework? And we have, I can tell you that just the CVI, the Climate Vulnerability Index, can identify people who are double the risk, triple the risk of heart attacks, you just using one single number. So that's really something that can play into risk assessment, meaning that if I predict someone has high risk of heart disease in the next 10 years, then I can prescribe the right medicines for them. I can advise them from an environmental perspective, and I can reduce their exposures. But also, it helps me understand what are some of the components of that index that are more impactful for my patient. Is it a road traffic type of exposure? Is it noise? Is it light? Is it a lack of green space? And what type of health outcome are we talking about? Allergies? Are we talking about respiratory? Are we talking about cardiovascular? So I'll stop here for the sake of time, but happy to talk later.
Yes, take a look out for our paper.
Yes.
I know that we are at about the end of this, and I had another question for Juan to tee up about healthy communities and community leaders education. But I think what we can do is perhaps, I know I see a lot of very incredible community advocates, so I encourage you to come up and ask your questions. But I think we can open up our panel to take some questions from the audience, if that's okay. Please, come to the microphone.
You go first. I asked too many questions.
Okay, all right.
Perfect.
Yeah, thank you so much. So I have two questions. The first one is for Dr. Hang. You mentioned that most of the apps and alert systems that we have are inaccurate. I do agree to an extent. Are there any air quality apps or alert systems that you would recommend for community members to be put on their phones or something to tell them what the air quality is that is more accurate than most of the common ones we know? So any recommendations in that? And my second question would probably be for you, Dr. Alkindi, and that has to do with what you're talking about previously. What would it take for us to incorporate environmental determinants of health to practice, in health practice? For example, how you go to the doctor, you fill all these forms, they talk about food insecurity and all that. And those are social determinants of health. What would it take for us to get environmental determinants of health to that level? Thank you.
Thanks for a great question. The short answer is I don't know which one is the best. Well, I talk about the alert is because from my personal experience. So I moved to Houston about 1 year, or a bit more than 1 year ago. I can, smell something in the air, but I don't know what is it. And I open my phone, open the app to see the air quality index. It says the air quality is great. Then I reached out to Harris County Public Health because I know for these AQIs, they're mainly generated from the 6 standard pollutants, and they don't have detailed information from the chemical components. So the total PM maybe missed the standards, but the chemical components we don't know. Yeah, so that's the reason I mentioned the alert. Because I don't know which alert is the best, my action is I closed my windows of my house. And also recently, I felt maybe I have some patterns I cannot breathe well. So I recently did an asthma test. I passed test. Myself is looking for the reason why I felt difficult to breathe. So I don't know. Yeah, but I really think that's an issue for the alert because it's not that much accurate. It's 2 cores. Yeah. Thank you.
Yeah, and to answer your question, I think we are getting there. It's happening. At Houston Methodist, for example, every single patient gets what we call geocoded, meaning that we take their address because we want to dig down a little bit deeper into their micro environment, micro neighborhood. So we geocode every single patient, and every single patient is linked with a spectrum of health of exposures, whether it's PM 2.5, ozones, and so on and so forth. Now, currently, we don't provide this information to the clinician just because the clinicians don't know what to do with it, right? So, but what we're doing is we're contextualizing this into something that the clinicians and the patients can utilize, which is basically creating clinical risk scores, because that's what we're trained on, right? We're trained on identifying someone's risk in the future. And we actually have really good prototypes at Houston Methodist right now that work. You input your address, and it could be something that could be done publicly as well. You just input your address, and it gives you a health profile for your neighborhood, and expected based on your environmental exposures today and next year and so on and so forth. It automatically pulls this data, and it tells you your risk of, if you live in this neighborhood, your risk of having a heart attack in the next 10 years is this much compared with this person. And we actually have a student who's working with us to create a website that can also compare neighborhoods. So you input 2 different addresses, and it gives you, okay, this is better from this aspect, this is better from this aspect, and this is better overall from a health perspective.
And I wonder if there's an opportunity there to expand environmental and climate related training during medical training, so that clinicians can then really be more in tune with looking for those signs.
Right.
Okay, oops, how does this work? Oh, what the heck? You guys can hear me?
Yes.
Yeah.
Thank you all very, very much for all this information. And Dr. Frank, I share the same challenges that you have. I've got to look at a number of apps to figure out whether the air is actually really good or not, or whether I'm imagining it. So that's why I always wear this little thing right here to help clean my air. But my question is this: with the change in the EPA's outlook on how to monitor all of the conditions out there, are we seeing a withholding of funding or a withholding of access to continue to do what you guys do? Or did I just ask the loaded question?
No, it's definitely yes. I can tell. I mean, sorry, the question was to you actually. Yeah,
Oh, for me,
yes.
yes.
All of you.
Okay, not just me. Yeah, the question, I would say, we have been working on a document to get more, still have funding for the direction, like around 100, a bit more than 100 professors across the U.S. We are working on a document together and has been submitted that document to ask if we can continue the funding. Yeah, we are working on that.
Yeah.
Yeah.
The issue is that with health, at least with health studies, everything has been halted for the past, several months right now, right? And I suspect that going forward, we're going to have to spend billions of dollars to understand why Tylenol causes autism, right? So there's a lot of issues here that, hopefully we will continue as scientists to find sources of funding, right? Whether it's philanthropy, and Houston is a great place for philanthropists who really have pitched in, but other foundations as well that can really help bridge that gap until we understand what's going on with health and science and research.
Dr. Aguilera Mendoza, do you want to reply to that?
Just to echo what my fellow colleagues had mentioned, there's been challenges in regards to securing funding for this type of work, but we also tend to be resilient in the academic environment where we know how to approach different sources of funding as well. There's been opportunities to interact, whether it's not at the federal level, then at the state level, local level. Currently doing the work with counties in the county of El Paso to do a needs assessment for communities living near a refinery. I serve at the Community Advisory Council for the Bay Area Air Quality Management District, and they're, I would say, at the forefront of involving community members in their decisions and integrated work to have them at the table as well for us as far as their communication. Part of what they do over there is that also what they secure from funding from the air permitting and also the fines, they give it back to the community and they put out community grants and funding to that. So we're hoping to learn from those models as well and replicate something similar with Texas agencies, so there can be like more ways for the polluters to give back at least something back to the community and hear the voices of the community.
And I will say that I think scientists especially are very resilient, and they learn from what works and what doesn't work, and you try to make what works amplified. And I think this will be our last question.
Thank you very much. I'm a member of the Channelview Health and Improvement Coalition, and we're right in the middle of the cancer cluster, high pollution, industry, cars, highways, all of it. There's nothing that we're missing. We live in a very dangerous atmosphere. So we, as members of the Channelview Health and Improvement Coalition, we do research. We try to find practical solutions for what we're facing. So this is one about air. It's simple, easy to access. We get 20 by 20 box fan, like you can get at Walmart, Lowe's, 20 by 20 box fan. Simple, durable, long lasting. Then we tape a air filter to it, duct tape it, and let it run as long as I've let mine run for weeks, no problems. You can get air filters that will take the particulate matter down to 2 microns. A hair is 70. 2 microns is pretty good. It's not perfect, but it's something we can afford. A $25 fan and a high quality filter for $25. So $50 you can protect the air that goes into your bedroom overnight. It lasts about 3 months. So that's a practical solution that we've discovered, and we hope we share it with you, because All the scientific things are very good, but very few members of our community know about it. It's a lot, very technical. This, they can understand. A box fan and a filter. Thank you.
Yeah, absolutely. And I think I've seen a video of Dr. Uwak, who is making one of those homemade air filters. So you might look online and see her video. But I think that really highlights an important, there are solutions to be had that don't cost a lot of money, whether that is a box fan filter, whether it's using like materials to create like just capturing air to be able to sample it, or other things. And I think it doesn't cost, it shouldn't cost an infinite amount of money for us to come up with innovative solutions to help improve our health. So thank you for sharing that. Okay.
That was the last one.
That was the last one. So I want to thank everybody for their attention and their time this afternoon, and especially want to thank our panelists for sharing their expertise on air quality and health.
All right, thank you, everybody. We'll reconvene. Thank our panelists one more time.
Thank you.
Thank you.